I am going to discuss with you lower eyelid fillers. They're commonly performed to fill in lower eyelid creases and folds. Some of you have not had fillers yet, and there are patients who've already had fillers and now have complications. I'm going to discuss both issues with you: the ideal patient, when you should have a filler, when you should consider it, what type of filler to choose with your doctor or your nurse, and how are we going to remedy the problems that may occur immediately, a month later, and maybe a year or more later. Each one of those scenarios requires a different approach. I'm Dr. Joel Kopelman. I'm a facial plastic surgeon, and I also do oculoplastics for the past 35 years. I've been injecting lower eyelid fillers with hyaluronic acid gels for approximately 15 years. I can tell you what to expect in most cases. However, I do want to say that even in the best hands, some complications cannot be avoided, and I'll explain why in a minute. So in most cases, when people seek out lower eyelid fillers, they're seeking out what's called hyaluronic acid gels. That's the most common, most widely used material to fill in volume loss on the lower eyelid. What exactly are these molecules? These molecules are actually sugar molecules that are linked together in a chain, and they tend to draw water into the area where they're injected. So actually, the filler is only part of the filling of the volume of the area that you're filled, because after you inject, it draws water in, which actually puffs up the area even further, which adds a layer of variability in terms of the final result. So if I approach a patient and I inject a certain small amount of hyaluronic acid gel, I know tomorrow I have to anticipate that there is going to be some water drawn into that area, and actually may fill in the area more the next day than it appears on the first day that I inject. And that's part of the art of injection. And that takes experience to know how much to inject. Now, I don't always get it right. Sometimes I inject and it looks perfect. And the next day, the patient may say, "Gee, Dr. Kopelman, this looks really swollen, and I'm really anxious about the way it looks." Well, I usually say to them, hold on, because there are immediate effects that may occur just from the injection alone. In other words, when you inject the material in the lower eyelid, it draws water in, or it compresses what's called the lymphatic vessels, which are all distributed underneath the skin, which usually pick up fluid in the area. And those vessels can get compressed just by the gel itself. So I tell the patient, please be patient. Let's see how things look after a week. So there's an immediate possible effect of having too much filler put in. Usually in my case, that's not the case, because I'm very conservative about how much filler I actually choose to inject. But the secondary effect of drawing water into the area may cause some puffiness. And that puffiness usually, in most cases, dissipates, and it may take up to a week to dissipate. I've had many patients who call me and say, "Dr. Kopelman, it looks so swollen and everything," but after a week, it all goes away and it dissipates. So that's what I call an immediate side effect that I don't like. But I know, and I try to anticipate that and tell the patient, okay, it's all going to go away. It's going to be okay. Now, there may be a different type of complication that may occur a month later. There are patients who have swelling that occur or appear a month later. And in those patients, I think those patients may have been injected by, they may not have, the doctor who or the nurse who injected them may not have chosen the right type of filler to put in their lower eyelid troughs, in those little grooves on the lower eyelid. they may have chosen something that is a hyaluronic acid gel that has cross-linking, which can absorb or adsorb or bring in more water to the molecule. And those patients may develop swelling a month later, and those patients may require a melting of that molecule with an enzyme called hyaluronidase. In most cases, a small amount of hyaluronidase injected into those areas, distributed in little tiny injections along the area that's overfilled, usually can dissolve or break down these molecules into little parts. So think of that long chain of sugar molecules connected. Now they're chopped up into little pieces, and that usually dissipates that lump that you see a month later. However, there's some patients where the swelling persists, and that may be due to the fragmentation of this chain of sugar molecules, which actually pulls in water. Even the small chains of molecules could draw in water, and you have a persistent swelling. In those cases, you might need a repeat of the hyaluronidase to break down the molecule even further. Now, there's been a lot of discussion about the side effects of hyaluronidase. It is true that naturally we have hyaluronic acid in our skin itself. That's why the hyaluronic gels were chosen to be compatible with the injections on the face. They synthetically made molecules that simulated our natural hyaluronic acid gels. These molecules, these naturally occurring molecules, can also break down due to the injection of hyaluronidase. So there may be some swelling and edema as a result of the injection itself. Actually, it may look like a deflation of the skin itself because you're breaking down the natural hyaluronic acid that's found in the skin. So one way to try to mitigate this side effect that's undesirable is to use very small amounts of hyaluronidase when you're attempting to break down the hyaluronic acid gels. Okay? I know that sounds a little confusing, but the doctor or the nurse who has a desire to help you has to be ultra conservative about how much hyaluronidase they are using to break down the gel that may look a little lumpy either immediately or a month later. Another option, of course, for a patient who has too much filler put in and has a lump is that they can wait it out, but it may take anywhere from 6 months to, believe it or not, several years for that to go away. And some people actually develop lumps way down the line. A couple years later, they may find that their swelling is actually getting worse, and it may look blue. It may have a blue tinge, and that blue tinge is called a Tyndall effect, and that may occur because the injected hyaluronic acid gel, which didn't break down originally, is now starting to be fragmented into little pieces, and now it's actually imbibing, bringing in water like a sponge and breaking down. And actually, these lumps get bigger with time. So in those cases, the doctor or the nurse has to resort to injecting hyaluronidase again to try to dissolve these areas. Sometimes these molecules are very difficult to dissolve, especially if the doctor or the nurse who originally injected it used a heavily cross-linked molecule type of hyaluronic acid gel, which is difficult to break down. So I prefer using something like Restylane or RH1 or 2 to inject around the eyelid, because those molecules are easier to break down. They don't draw in as much water. If the doctor or nurse chooses to use something like Juvederm around the eyelid, those are usually cross-linked molecules and they're more difficult to break down. So choosing the right molecule right from the beginning is key. And another key aspect of the treatment is how the injection is performed originally. So when I inject on the lower eyelid, I inject in a very deep plane above the bone, above the periosteum, the covering over the bone on the lower lid. And I don't inject in the muscle of the eyelid because there's muscle above, right below your skin, there's a muscle there. And there is actually some evidence that injecting into the muscle itself may cause some necrosis of the muscle and accumulation of fluid. So people who have chronic swelling down there may have gotten injected too superficially, and that is the incorrect plane of injection. So it's critical, whoever you go to has to have experience and has to have anatomic knowledge about the area that they're injecting. I know that people go and choose providers based upon what the cost of the injection is, and the financial considerations override the experience of those injecting. But it should not, because the experience of the injector is much more important than the cost of the injection, because you probably potentially can avoid many of the complications that people encounter. One of the ironic things about dissolving filler that in patients who have bulges on the lower eyelid is that once the filler is removed and the bulge is removed, it can uncover the wrinkling and the aged look of the lower lid skin. And so all of a sudden, the person removing the bulge appears to have precipitated a cosmetic problem that many patients are unhappy with. In those cases, the patient either has a choice of either living with their wrinkles, or in most cases, they want to revert back to a state in which they can get re-injected with the hyaluronic acid gels. And usually I recommend waiting 4 to 6 weeks before you have a re-injection of the area following the dissolving of the original material in order to restore the appearance of the lower lid. Some people opt to have surgery done, however, rather than have injections at that juncture. But very often people who choose to have non-invasive procedures, non-surgical procedures, usually opt to have re-injections of their lower lids with additional hyaluronic acid gels. Patient selection is very key in terms of avoiding complications. The patients who have defined grooves in this area with a bony elevation here, or don't have any history of allergies or swelling around their eyelids, have minimal amounts of bulging fat, those are the ideal patients that can benefit from lower eyelid hyaluronic acid gel injections. If a doctor or nurse injects above the rim here in the soft part of the eyelid, they're venturing to area where the material can drift posteriorly or may create a lump that is very difficult to remove. So again, it is key that they understand the anatomy, they understand who the ideal patient is, and in 90% or better of the cases, they're going to have happy patients in the end. But everything has to do with experience, preparation, and making sure that they don't have blood thinners on board, which could lead to hematomas and bruising. All those things are important in preparation of having an injection and staying safe. So the takeaway here is complications do occur even in the best of hands. However, frequency of those complications can be mitigated by going to people who have experience and also choosing the right fillers and the right candidates for the procedure. I hope you found this video to be informative in terms of the types of complications you may encounter from lower eyelid fillers. If you have any further questions, please leave them below. Please subscribe to my channel, and I look forward to seeing you again in my next video.